what are some unhealthy thought patterns that I have that contribute to these feelings, unpleasant feelings that I'm having, and these behaviors that are not the most helpful for me. My name is Celina Serna. I am a program director and a licensed clinical social worker here at Clear Behavioral Health in Van Nuys. I have been working in an IOP level of care for about 4.5 years now. So most of my experience, most of my work in a clinical setting is with teens, with families. I do have experience working with adults as well in hospice care, medical social work, but the bulk of my experience is going to be with teens in an IOP level of care. So one of the most effective treatment models that we use with our teen work is family therapy. We do find that most times when teens come in here, there is dysfunction in the family, whether that is teens and parents not being able to communicate with each other, whether that's different life stressors that are happening in the home that are causing people to feel overwhelmed or stressed out, worried, scared, and people don't typically know how to communicate those things. So what you see is a shift in the family system where people are maybe more withdrawn. Maybe sometimes parents work more to not have to face some of the stress or changes that are happening in their home. Typically, when we are working with our teens, we do like to use a cognitive behavioral model or a dialectical behavioral model, which is short for CBT or DBT work. Typically, when we see our teens, we're really trying to help them regulate their emotions, which fits in that DBT model, right? A lot of teens are coming in here, they're dysregulated, they're going through a lot of distress, they don't know how to communicate effectively in their interpersonal relationships, and they're really just struggling to connect and stay present. DBT model usually will help our teens learn skills to really regulate themselves and to help them in moments of distress, and again, just to communicate effectively with others so they can learn how to get their needs met in an appropriate way. When we're looking at a CBT model, we're looking at how to help the clients become aware of how their thoughts affect their feelings, which then affect their behavior. So we call that the cognitive triangle. And really what we're trying to help our teens is learn and identify what are some unhealthy thought patterns that I have that contribute to these feelings, unpleasant feelings that I'm having, and these behaviors that are not the most helpful for me, or in this case, for the teen, when they're going through unpleasant experiences. Another modality that I really love to use with teens, it's called acceptance commitment therapy, which is short for, or is long for ACT, or stands for ACT. And really what we're trying to do is help our teens accept the experiences that they're having, allowing those thoughts and emotions that are unpleasant to come and go without judgment, and really planting themselves in this thing which is almost like a storm, an emotional storm, if we can say that. And we're trying to just help our teens really tolerate what's happening in their life without having to resort to unhelpful behaviors like substance use or self-harm or having dysfunctional relationships. Another model that I've liked to use in my work with teens is psychodynamic work or insight-oriented work. So I'm really trying to help my teens gain some insight into what they're experiencing, whether that's emotionally, cognitively, or just in their relationships with others at school or at home. I've noticed that in my work, most times teens like to bury their emotions. They try to avoid what they're feeling, and by doing that, they're finding other ways to cope that are negatively impacting their life. So if we can help our teens get some insight and awareness into what they're feeling and why they cope the way they do, then usually we can help them get a little bit more stabilized and help them find other ways to cope that are more helpful or more healthier. We have the families in here working together and to really help them communicate and learn how to be in distress with each other and learn how to support one another through these challenging times. So the difference between a therapist and a case manager is the therapist is really going to focus on that insight-oriented work, really explore what's going on underneath the surface, whereas your case manager is looking at how is my teen living in their environment, what are they struggling with, and what resources do they need to help them stabilize. Our case managers are really giving them referrals or just trying to connect them to community resources to really give them that wraparound service that I talked about. So at Clear Behavioral Health, we really believe in working with the family system. Most times what we see, and almost every time, each family member has a role in this family system, and we're not able to see that when we're living inside this bubble with the family, right? So really what we're trying to do here is help each family member understand, what role do I have in this with my teen? What role does my teen have with the family system? And how are we all functioning together? Most times the family system is rattling, and what we're trying to do is to get each member understand how they're impacting that rattling system, identify those behaviors, and really doing something different. When I'm working with parents and families, I'm seeing parents wanting their child to be fixed. And most times I just like to tell parents that therapy is not putting a band-aid on wounds. It's not really putting a bucket underneath the leaking roof and trying to have an easy fix. We really want to support our teens and help them get through these challenges and make everlasting change. I would tell the parents, we need to get on the roof and we need to fix the foundation, right? That takes a lot of time. It takes patience. It takes understanding, and it takes more than one person to be a part of that journey to really make a difference. And I really like to emphasize that with parents that I work with, because it's a scary time. You know, it's really hard to see your teen go through challenges that are really impacting their life in a huge way, but it's so important to make sure that we're fixing the foundation of what's happening and not just trying to put that bucket underneath the leaking roof and thinking that everything is just going to be fixed in a few days or a week.